Greg and Rob, we are going to be diving into some policy discussion moving forward, but I want to start with your personal stories. I wonder if you could tell the audience here a little bit about how you actually came to this line of work and how it's informed the way you think about gun violence through the lens of public health. Greg, we'll start with you.
Yeah, it was a pleasure to be here, and unfortunately for me, my start to this work wasn't through ambition or application. It was through tragedy. In April of 2013, I was caught in a shooting and was shot, and the bullet that hit me hit 2 arteries, and I came within 26 minutes of losing my life. And I'll never forget coming out of one of 6 surgeries in my 6-month recovery, but really that first surgery, and turning on the news and watching leaders in Washington refuse to take action because I was shot just 3 days after the failed Senate vote on universal background checks in the wake of Sandy Hook. And so that's where that fire really started to burn with me about how do we change things and how do we push Washington to do more on this issue.
And Rob, your story?
Yeah, so my cousin was shot and killed in January of 2001, making me like 54% of American adults who know someone in their family or friendship circle who's been affected by gun violence. She was on winter break from Haverford, volunteering at a local hospital when someone walked in with a gun who shouldn't have had it. I moved to D.C. to start taking action right out of college, and I was welcomed with a headline that said, with the election of George W. Bush, the NRA would work out of the West Wing. And if you think about progress, and I think about what we're here for, within 20 years, instead of the NRA working out of the West Wing, you had 2 gun violence survivors, 2 gun policy experts, leading the first ever White House Office of Gun Violence Prevention.
What a testament to your leadership. It's a novel office. We're just a little bit over a year into the office being formed. And I know you've put out a progress report. I wonder if you could tell me briefly what one key accomplishment you've gotten in the last year is that you outlined in that report, Greg.
Want to kick it off? There you go. Well, look, I think the big thing is that we ushered in the first ever public health approach to the issue of gun violence. Yeah. I know when I was shot, when I arrived at the hospital, I was met with investigators and law enforcement before I was met with doctors and surgeons. And in America, that's how we looked at this issue, as a crime to solve and not a public health crisis to prevent. But we started to shift that. And whether it was the first advisory from the U.S. Surgeon General naming this a public health crisis, whether it's President Biden, the first president in history to name this as a public health crisis on December 21st of 2020, but more importantly, the interagency approach that we were able to build. We had 12 different agencies that played a role in addressing this crisis, over 54 executive actions, $30 billion in additional funds to prevent violence, and passing the first law on gun violence in 30 years. And so that all has greatly informed and impacted how we've attacked this issue. I do want to pass it to Rob, though, to share a few specifics.
Yeah, look, I think the biggest thing we did is we went from solving yesterday's crime to addressing today's public health crisis. And you do that by actually motivating folks outside of just justice and law enforcement. So we focused on the Department of Labor and their youth summer employment grants. We focused on pivoting the grant programs to help remove guns from domestic abusers. We focused on getting more data on gun violence. And we focused on the industry, honestly, who's been profiting to a tune larger than Nike on guns. And what we focused on were the bad actors. And so we shut down more gun stores, rogue gun dealers the past 2 years than the past 20 combined. And that's how we make progress, is we actually go at the problem.
Rob, this room knows how to follow the data, so I'm glad you mentioned data. For the public health community, they've often lacked the ability to have transparent access to data on gun violence around this country and those who are living with injuries. I know the federal government has access to some of that data behind the scenes, but what's it going to take to bring that to the public eye?
Look, you all are so important to this crisis because we're going to leave these seats in 50 days, but your efforts are going to continue. So one of the things we focused on from the very beginning was getting you better data, because we need to know where people are getting shot, injured, and killed, timely and local, so we can both implement solutions and measure progress. So what did we do when we started? Greg and I went to HHS. We said, you built a system to figure out when somebody sneezed across this country.
Right.
You telling me you can't tell me when someone got shot?
Right.
And so what they've done is use the hospital data systems, the same ones that were built for COVID, and filled those canals with gun violence data. So we do now have hospitalization data on gun injuries that has a 1-month lag down to the census tract. We have death data that has a 3-month lag down to the local level as well. And that actually gives us the first ever national picture on gun death and injury, so we can focus and target our solutions.
And I just want to reinforce, there's some really big findings in there. You know, we found that gun violence is the #1 cause of newly disabled Americans. It's the top 3 cause of death for pregnant women in America. We talk about how this is the #1 cause of death for youth. Only 1% of that happens in schools, right? So we're starting to see the full picture of what this crisis is. And we know that data can really empower you, as all of you are part of this movement, whether you signed up or not. But now you can start to see, okay, well, if this is the challenge in my community, like Intermountain Health, for example, where they're looking at, okay, how do we creatively get to older rural men that we are seeing surging in suicide? But with that data, we can empower this broader movement to think of new and innovative ways to solve this crisis.
And I think on the data, if I could just say, one thing in a limited time we have to tell you is that the solutions we put in place the past 4 years, we've seen success. And it's hard to measure success with an issue as painful as this, but last year we saw the greatest, steepest decline in gun and homicides in the nation's history, 13%. Which is amazing.
Yeah.
This year, it's 17%. City like Philadelphia saw a 50% reduction. City like Baltimore, over 40% due to the partnership of local state government, LifeBridge Health System, Safe Streets, right? These solutions we know work. And the question we're confronted with, are we going to double down on them, even without this office, or are we going to walk away?
Well, you've hinted at the elephant in the room, which is what becomes of this office in the next administration. And it might not be something that you can necessarily answer to, but I wonder how you'd like to see the torch carried.
You know, look, the previous administration was very clear that they did nothing on this issue. They even bragged about it. And we know that this is not a topic or a debate. This is literally our family, our cousins, our friends. It was almost my own life. Last fall, I lost my mentee to gun violence. Someone who actually came to Capitol Hill and fought for the Bipartisan Safer Communities Act was shot and killed in his front porch. So we can't expect them to carry the ball forward because they've already set their agenda. But what we're inspired by is all the work that we've laid out. Those 54 executive actions are a big deal. You know, now that Medicaid can be used for violence intervention programs and safe storage, adding $2 billion to the Victims of Crime Act, victim services, putting $400 million into community violence intervention, hosting the first ever convening of 60 health CEOs from across the country. Those are all, you can read them all in our report, but those are highlights of the critical work that we've done, and that work will continue to ripple as long as we have people to carry the baton.
And let me be very specific. We didn't offer a prescription on this issue. What we offered was a playbook. And we don't need the federal government to run those plays. Our state leaders, our local leaders, our health systems, our schools, all of us, our philanthropists can run those plays. And so we've published it all, and we just know that we need to get this playbook in action because that's what can save lives.
A final question for you, Rob. Given your work on the Bipartisan Safer Communities Act, what is the lasting legacy of that beyond what the White House is able to do now that we have this legislation in place?
Yeah, look, that was the first law to pass in 30 years. Time and time again, we failed to pass federal legislation. But what was the difference this time? Was it more Democrats? No. There was 50 Democrats in 2000, 50 Democrats in 2012, 50 Democrats in 2022. The difference was 15 Republicans joined with us to vote for gun safety because we have changed this issue. We have changed the politics of it. We've changed the policies of it. And so that law both set new standards for gun sales, closed the gun show loophole, addressed dangerous boyfriends who are convicted of domestic abuse, funded $15 billion, and when it was written, those $15 billion don't need to be appropriated. They already were. So we can keep investing them the next 2 years. And it's not just us talking about this law. Last week, the 3 leading Republicans who negotiated wrote an op-ed that said the Bipartisan Safer Communities Act gives us cause for optimism. So I hope that gives you cause for optimism as well.
We'll leave on a note of optimism then. Thank you so much, Greg and Rob, for your moving story. Appreciate it.